Transforming care through genomic medicine, personalized therapeutics, health services and outcomes research, and innovations in healthcare delivery. We're Children's Mercy Kansas City, presenting our audio interview series, Transformational Pediatrics, with host Dr. Michael Smith.
So today's topic is the state of children's health in Kansas City. My guest is Margo Quiriconi. She currently serves as Director of Community Health Initiatives at Children's Mercy Hospital. Margo, welcome to the show.
Thank you. I'm glad to be here, Dr. Mike.
So I noticed, I want to talk a little bit about you first, how you got started in what you're doing in community health. I noticed also that you founded something called the consulting group Q Works. Why don't you tell us a little bit about that?
I got started in the importance of children's health is that when I was a middle school child, my family moved from Michigan down to Mississippi. And when I moved down to Mississippi, I was always remember, even as a young middle school student and living on, that I just saw the incredible inequities about how children were living and were treated in schools and in their communities, and I never liked that. And I committed myself in my career to working on improving community-based programs and outcomes for children. I have a strong belief that no matter where you're from, what your zip code is, that all children should have the same opportunity and have the same potential. So that's led me to a lot of really exciting opportunities, working on infant mortality in the Mississippi Delta, to developing adolescent pregnancy and parenting programs, to working on with a philanthropy organization in Kansas City where we were transforming education systems and education programs for children across the community. I then started a consulting group where I worked on a number of exciting projects looking at high utilizers of the emergency rooms at our local public hospital, to working on the development of an infant mortality project in the eastern part of Missouri, in St. Louis and in the Boot Heel, where there's the highest infant mortality, to another project working on with our local Black Healthcare Coalition. So I really enjoyed the diversity of the projects and was happy to come here to Children's Mercy to a new position that they had established to try to bring a more strategic approach to the community work that Children's Mercy was engaged in.
So let's bring it back then to Kansas City. The
Yes.
topic is the state of children's health in Kansas City. So just in a nutshell, where, in your opinion, Margo, do you think Kansas City has been? Where is it today, and where is it going when it comes to the state of children's health?
Well, I think one of the concerns all along for Kansas City is that we don't have enough emphasis on what's really happening in the day-to-day lives of our infants, children, and adolescents. And we need more of a stronger emphasis on what can we do to make the conditions better. There's a number of efforts in the community that are happening to improve the schools and improve different systems, but we're still seeing that children and families are under a lot of stress in the region. A lot of that is from financial stress. A lot of it is just from the stress of managing dual working families, managing all of the different demands and expectations we have that society is putting on children and their families. And so in our report, we did this study of what's happening with children's health in 4 counties, in Johnson and Wyandotte counties in Kansas, and in Clay and Jackson counties in Missouri. And one of the themes that we saw throughout when we surveyed families and when we did focus groups and talked to key informants was that they recognized and addressed that families are really under a lot of financial stress and getting their day-to-day work done, and that has implications for children.
So I have it here. So you're speaking about the community health assessment that Children's Mercy did with assistance, I think, from some professional research consultants, right? In
Correct.
that 4-county region, in that 4-county region, and from that report here, I have listed that the report identified numerous issues, including poverty, employment, violence, parent support, access to care, behavioral health, housing, obesity, food insecurity, early education, and infant mortality as the main focus that Children Mercy wants to move forward with. Is that where are you at with that? I mean, if those are that's a big list, right? that's a lot
right.
to try to make improvements. So what's the plan? You've identified the issues. I guess what's the plan then moving forward for the kids, at least in those 4 counties?
Yes. So I want to clarify the issues, those important issues that you listed. We took the data from this needs assessment out to a group in the community of close to 200 individuals, and they actually identified that list as being what they saw were critical issues facing children and families in our communities. And so we took that list back into Children's Mercy and went to probably close to over 600 of our staff members and across the Children's Mercy system, presented data to them, presented those 11 issues, and then we had a process where we then ranked those issues on what could Children's Mercy really make a short-term impact on. And the top 3 issues that rose for where we could really play a significant role were in infant mortality, in mental health, and as well as in access to care. Now, the other issues on that list, we have a number of really important programs happening in those areas, but we felt we wanted to trim that list down and say, okay, these are 3 we want to go deeper on in the next 3 years.
Right. Let's talk about one of those specifically that Children's Mercy is going to focus on, and that's the access to care. Because I know that's a big issue depending on where you live, right?
Right.
If you're close to Children's Mercy, you're getting the best of the best, right? And all the specialists you need. But if you're, as you go further and further out from the city, obviously access to care becomes an issue. So what's the plan then to correct that? Is it simply opening up more satellite clinics? Is that part of it? Or what are you guys thinking here?
Well, we're in the planning process right now, and we're looking deeply at the data that we received from the Community Health Needs Assessment, as well as then we're bringing in different community partners to better understand what they're seeing might be some of the barriers to access to care and what they think could improve access to care. So, for example, one of the pieces that we've discovered in our needs assessment is that a bit over 44% of families in Clay County who participated in our telephone survey of this assessment shared with us that they had struggles with or delays in getting access to health care in the past year. So we paired that data. Children's Mercy has an urgent care facility on Berry Road in the Northland, and so we looked at with some of the physicians at that facility and looked at the urgent care utilization. And we discovered that one of the zip code zones in that area north of the river has some of the highest urgent care utilization of any county, any zip code zone in the 4 counties. And so now we're working with the Northland Health Alliance and some other partners to better understand what are the struggles of some of those families, of what's making it difficult for them to get into primary pediatric care and to identify with a medical home. Because urgent care is not the place where you go for your routine health care, and that's what we were seeing from some of the data, that some of the families are going to urgent care perhaps 12 times a year.
They're using that as their primary physician, basically.
That's what we're hearing. That's what we're hearing, and that's what we're seeing from the data, yes.
Where do you think in this process does telemedicine play a role in some of this?
We are working and looking at identifying how telemedicine might play a role in working on providing primary care and what the best access points are for telemedicine. But certainly, all of that is on the table, and we're examining what might be the best way that we can use our resources and work with community partners. It's not. I don't think some of these challenges take more than just one organization, and then really finding out what the families need and better understanding. So what's making it more comfortable for them to go to the urgent care versus going into a primary care provider, and how we can get them into the best care for their children.
So as the director of community health initiatives at Children's Mercy Hospital, Margo, what are some of your goals for the near future for your program?
Yes, well, one of our goals is that we are developing what we call the implementation strategies around each of those three priority areas. So that's one of my close goals, is to develop meaningful implementation or action plans about how we're going to work on these issues over the next 3 years. Another important goal that we've had is we've started a few new programs here in the past year at Children's Mercy. So working with my colleagues in the institution who are working on those programs to help them to get those programs off the ground, to help them make additional community connections that they need, and to develop the evaluation strategies. Two of those programs are, one is called Coaching Boys into Men, and this is a adolescent program targeted at high school athletes and works towards reducing violence in interpersonal relationships between young men and young women, and young men and other young men. It's been an evidence-based program that the Centers for Disease Control has conducted very positive research studies on. And we have been training high school coaches in the Kansas City, Missouri School District for all their athletic coaches to be delivering this program with their athletes. And the words so far from the coaches are they're loving this program.
Awesome.
So we're going to continue to work on expanding that and addressing additional needs they have.
So this is what you're taking on. Obviously, Margo, is a huge job, but it's so important. If you look at the issues that were identified in the phone survey, I mean these are societal issues that I think does take an organization, an institution like Children's Mercy to kind of champion. And network and bring other organizations in. I think you're doing a great job, and I want to thank you for the work that you're doing. And I look forward to maybe having you come back on maybe in a year or so and hear where you're at with everything. I think that would be good. So, Margo, thanks for coming on the show today. You're listening to Transformational Pediatrics with Children's Mercy Kansas City. For more information, you go to childrensmercy.org. That's childrensmercy.org. I'm Dr. Mike Smith. Thanks for listening.